So I hope you've all enjoyed a little bit of the salad and and had a little bit of a break. I know that the intellectual feast that we had this morning will be continued this afternoon. And I want to, before I turn this over to Jim Knickman, I want to make sure that I remind you, particularly the Roundtable members who seem to be noticeably not at their places yet. But I'm going to remind you in absentia that we want to have you be thinking about commentary, questions, not certainly questions, but commentary and sort of synthesis as we go through the day, and to make sure that Dave, when he comes up here at the end of the day, he's going to call on each of you. I mean, nobody will be, no place to hide in terms of making your comments. So this afternoon, we have a panel that will be moderated by Jim Knickman, and the highlights of the work from the state and local governments. And so, without further ado, Jim, I'll turn it over to you.
Thank you, George. I'm really pleased to be here to moderate this second panel and to be joined by a great set of presenters. I think you'll enjoy what they have to say. I think so far today we've learned a lot. We've learned that ideas and evidence often, although maybe not always, come from academia. And I think we were dazzled by David's telling a story of these issues in life, and so much rooted in evidence. We've also heard last time that the federal government provides us policy, incentives, leadership, testing ideas, and chronicling things that work, and that's an important role. But this next panel that we'll hear from works at the level where we really start to see boots on the ground in efforts to promote healthy living and population health, and that is state and local and communities, and that's where I think health happens. Health is local, right? And we'll really have a chance to learn about innovative efforts to advance health in all thinking in one state, 2 different cities, and from a national organization that works with communities around the country. Before we start, I'd just like to make 2 personal comments. One is I'm really pleased that we have such a diverse set of presenters. I wrote a commentary earlier on saying I worried that us health types just talk to one another, and we really need to get non-health types into the room, and I think we've really done that well today, so I'm really pleased that that's happening. And the other thing I'd just like to brag about is that I'm really lucky to live in a city, New York City, where there's been great progress on some of these issues about health and all. Whatever you think of Michael Bloomberg, it's quite a trip to have a mayor who thinks sometimes that he's a dean of the School of Public Health, and in some ways he owns a School of Public Health, so it's sort of it's sort of pretty amazing. But anyway, having said that, let's turn to the panel. First, we're going to hear from Ned Codd. He's the Director of Project-Oriented Planning for the Massachusetts Department of Transportation. We've already heard a little bit from him. But included in his portfolio is responsibility for how transportation affects public health and climate change. He's a civil engineer. And Ned, come right up.